Mesa, City of Mesa employee health and wellness checkup, just to go visit. And I said to my husband, "Oh, there's a trailer over there. I'm going to go get a mammogram." It was like maybe 3 years since I had one. So I went in there, got my mammogram, and then that was like in October of 29. And December the 20th, I got a notification, the results, that I had something that they wanted to look at. Okay. So then I went back into the doctor's office, and I had a biopsy because they found something on my mammogram, and they had a biopsy, and then they found out that it was a tumor.
Oh, how old were you when that happened?
I was 70, I'll say 73.
So chemotherapy, it's basically a medical regimen, and there are lots of different varieties, and they're designed to interfere with the metabolism of cancer cells. The problem is that oftentimes the chemotherapeutic regimens are relatively non-specific, and so one of the side effects might be that it would affect normal skin cells or normal dividing cells rather in your body. So they work in different ways, but the classic one is to combat the division of cells, and so that a cancer cell, which divides very rapidly, would be halted in its tracks, if you will. And that's one reason that patients will often lose their hair and have GI problems, because production of hair and also turnover of cells in your GI tract, something happens at a relatively rapid rate. So that's one side effect with battling cells are dividing rapidly, and that's how cancer cells tend to work. Cancer cells are essentially rogue elements, right? You probably know this, but
yeah.
They're dividing uncontrollably, and all the stop signals that are normally in place for checks and balances are not effective. It's become more advanced in recent years. We do use things like biologic and immune modulators that are effective at battling cancer cells as well. And in fact, some of them are so effective that we don't even do operations anymore for tumor resections and things that a few years ago we would routinely.
Sure. Okay, so I had the biopsy done, and then did not know who to go to, and I went to my family doctor, and he recommended to go to Cancer Research, Ironwood Cancer Research Center in Mesa. And he recommended Dr. Helber. Do you want to hear all that? My doctor's names? Okay, and then I went and had a visit with him, and he, went over the process. Yes, you have a tumor, and I'll have to send you to another doctor that was in that facility who was my surgeon. And they found out that my cancer was a tumor. So I had to go to the surgeon, and he went ahead and examined my mammogram and said, "Oh yeah, you have a tumor, so that's got to come out." And so then that took place, and I went ahead and had that done at the hospital, my tumor taken out. And after that, I proceeded to go back to see Dr. Helber, and then he said to me, "You're going to have radiation."
Okay.
Oh, I've got to back up first.
Okay.
I have to have chemo. And then so I had chemo for, I think I had, let's see, this, I have all this right now. So I had chemo for 15 rounds of chemo, 15 rounds of radiation. And then after that, of course, they examined me again and everything, and they said, "Your tumor's gone." Not knowing, okay, what's this process? I guess you worry about, oh gosh, am I going to die because you have cancer, it scares you.
Yeah.
But I'll tell you, I went to the best cancer center in the world, and my doctors were tremendous.
Really? Where was that?
That was at the Ironwood Cancer
Okay.
Center. Yeah. So, but just not knowing, what it was. But I mean, I would tell anybody, you have to do it. So
Yeah.
you got to have a good attitude too.
Ironically, the more differentiated a tumor is, often the better prognosis they have. So
Yeah.
if it looks more like the native tissue, that would be traditionally a little bit more amenable to therapy. If it's poorly differentiated, that means it's so out of whack, it's an aggressive tumor that has acquired some rather mild attributes, right? And those are the more aggressive things that are harder to get under control. So the worse the grade, the worse they do by prognosis. And then the stage, so if they are localized to a certain area and they're more readily treatable, as we talked about. If they've metastasized, that's typically what we call grade 4. So stage 4 is localized to an area typically, and then stage 4 is it's spread everywhere else. So the better we are at getting at patients sooner, the better they will perform. As you can imagine, that's why early detection is so key. Team, depending on the stage of the cancer. So, for instance, breast cancer, treatment options really depend on several things. What's the size of the tumor? Where's the tumor located? And much of this is dictated by the initial biopsy. And so the biopsy can be done with a fine needle to take a small piece of the tissue, the tumor rather, and you can analyze that under the microscope, and you can actually set it off and do genetic analysis of the DNA, try to get a good grip on what sort of tumor it is. And you mentioned hormone therapy. So those tumors that have hormone receptors, it's advantageous for us because you can use hormone therapy.
It was about a year, 12 to 15 months. And I do take for the next 10 years, I take a pill for preventative.
Okay.
And that will just prevent my cancer from coming back.
Do you know what it was called? The pill?
I knew you'd ask me if I can't pronounce it. So.
It's all right.
But when you have cancer, you do go on something similar to what I'm on.
Okay.
And every woman that has had it will go on something for 5 to 10 years.
Okay.
But I'm thinking they put me on for 10 years because I'm older, Well, my advice would be go see your family doctor, trust him. He will recommend who to go to, and just go to a great place. That's all I can say. And I know these doctors nowadays know a lot more than they did 50, 60 years ago.
Yeah.
And this chemo and the radiation and surgery, it all works, And they give you different options, like, if you have a tumor, do you want to have your breast removed? They'll advise you, I don't think you do, but it's up to you, and stuff like that. But you just have to put trust in your doctor. I guess I'm just blessed that it wasn't worse than it was. And that I got it when I was a little bit older, because I would think the younger women would worry too much. But the bottom line for me is just I put all my trust in my doctors, and I was really, really blessed to have them.